Hey, good morning, everybody. It's John here, of course, and coming to you from Denver. And today is very dark, gray, and gloomy outside. Um, and cold, very cold. Um, so we are finally heading into week 8. So congratulations, you are about to cross the finish line, and we're done with discussion questions, and we just have the last milestone project to wrap up this week. So congratulations to all of you. This week, we don't really have any discussion matters to discuss here in this video, but I do want to take the opportunity to go over what I think are the biggest takeaways from this class. And so I've mentioned a few times throughout this class that my number one goal and objective is to help you do whatever I can to help you get value out of this class, out of the concepts, the principles that we're teaching in this class. So that's what I want to go over, and hopefully that has been your experience. I'm here happy to help, discuss any questions, anything like that. I'm always open, even after this class. If you have anything that comes up, please let me know. So, obviously we discussed a little bit, just for the sake of being comprehensive in terms of healthcare legal and ethics issues, although we don't really have discussion questions covering this issue. It's covered in your text, and we talked a little bit about the business and economics of healthcare, how healthcare is paid for in terms of private group health plans, Medicare, Medicaid, Medicare Advantage, the whole concept of managed care, population health, value-based health plans. And also some of the federal and state laws and agencies that govern healthcare and the healthcare industries, things like HIPAA. Talked a lot about HIPAA, a little bit about the Stark Law, anti-kickback statute, civil monetary penalties law, False Claims Act, and the governing agencies over healthcare from a federal standpoint, things like CMS or Department of Health and Human Services, the FDA. We talked a little bit about clinical trials. From the state law perspective, we talked a little bit about the corporate practice of medicine, patient abandonment, privacy, state privacy laws, medical record laws, licensure laws, and things like that. So those are some of the things that I think are good to sort of file back in your head as you move forward in your careers. For me, the biggest takeaways are related to legal analysis. I know we've talked a lot about that. We talked a little bit about, sometimes there's this marked distinction between ethics and legal liability in healthcare. This class is divided into two separate sections. We had the first week was sort of this introductory piece with respect to ethics, but then we went right into the legal component, through the lens of this Itraldi case. And then we got into the ethics piece. So, there's this marked distinction. I hope one of your takeaways is this marked distinction between ethics and legal liability, where you can act perfectly ethical, not always, and certainly the Itraldi case is an example of that, but you can act perfectly ethical within your scope of practice, within the rules and regulations of your respective professional code of conduct, and still have exposure from a legal perspective. So you can have legal liability and still act ethically. And so I think it's important. I think that's an important distinction between ethics and legal liability. Remember, this is where you sort of get into that analysis, the legal analysis. The legal analysis, right? I mean, you look at each of the elements of whatever legal theory is at issue, and if those elements are met, then there's some risk of legal liability, regardless of how ethically you acted. So remember the four elements. of the malpractice or negligence cause of action, the duty, breach of that duty, causation, and damages or harm. Your text refers to them as the four Ds. So remember that one of my big points of emphasis in this class was you can't look at a set of facts and say, oh yeah, there's negligence because of X, Y, and Z facts, right? I mean, they're all four elements have to be present in order for negligence to occur from a legal standpoint. Someone could have made a mistake. Someone could have been, quote unquote, negligent as we understand it as people, and as we understand that term is defined in the dictionary. But from a legal perspective, it's totally different. All four elements have to be present in order for there to be legal liability for malpractice or negligence. And so what that means is that you have to analyze each element. So was there a duty? What's the rule? Okay, so you state the rule. What are the facts? Are there facts that support whether or not there was a duty based on the rule as you understand it? If yes, then move on to the next one. Okay, was there a breach of that duty? Well, what's the rule? Well, what's the standard of care? Did this individual deviate or breach that standard of care? What are the facts? And do that analysis, and then move on to the third and the fourth element. And then once you've gone through that analysis for each element, that's when you can say, okay, well, there's some risk of negligence here. So, but only after an analysis of each one of those four elements. And that rule is so important. I mean, we went through that HIPAA discussion question we had in week, I think 4 or 5, where the question was there a breach? Well, I mean, you can't look at that set of facts and say yes or no, because you have to understand what breach means. And breach is a defined term. And breach does not mean any sort of use or disclosure of PHI that seems inappropriate. It doesn't mean that. I mean, there's a whole analysis, and I posted that link, and we went through this whole set of factors to consider. There are some exceptions to consider, and only once you understand that rule can you really apply the facts and understand whether or not a breach actually occurred. So in anything you do, it's important to understand what is the rule, how is this defined, and then apply the facts to that rule. So, in terms of legal analysis, remember define terms. It's something that, as a lawyer, I don't know if you have a lawyer in your family or you're married to one, it drives you crazy. It drives my wife crazy, because when she makes a statement or says something, one of my first responses is, what does that even mean, right? So how do you define terms for a casual conversation with somebody in your family or a friend? It drives them crazy. But from a legal analysis perspective, it's critical. You have to understand what terms mean. How do you define terms? A breach, for example. How do you define breach? Or how do you define duty? Or how do you define the standard of care? It's all the how you define terms is incredibly critical. Look at the relevant facts. Look at the material facts in a case. Pick out the material facts. You got to know the rule. Apply the facts to that rule and the defined terms. And really the easiest thing to follow, it's something that I learned in law school and still use to this day after many years of practice, is that IRAC form of legal analysis. What is the issue? What is the rule? Apply facts to that rule and come out with your conclusion. So that's the easiest way to do it. So I think, to me, legal analysis and understanding that concept, that distinction between ethics and legal liability, are really the biggest takeaways from this class. So anyways, it's been a pleasure. It's been an honor to facilitate the discussion in this class, provide feedback, and hopefully you got some value out of it. So again, if you have any questions, let me know. I'll be grading those Module 7 assignments this week, and then we just have that milestone project that's due on, I believe, on Sunday. So if anything comes up, let me know. If you feel like you're going to be a day or two late on an assignment, please let me know. this next week, it's really important. Deadlines are really important because I have a short turnaround time on submitting grades. So it's really important. If you are going to be late on this week 8 assignment, I really need to know because of the short turnaround time I have on submitting grades. That way I can look out for it. So anyways, let me know if you have anything, and if anything comes up, any questions or want to discuss anything from the class. But other than that, I wish you best of luck in your future endeavors and the rest of your classes and your careers, and hopefully you have a happy holiday. So take care. Bye.